Good day, Ma'am Sabit. I am Marian Jade Cinco from Grade 12 Gourmet. I am presenting the first aid, common emergencies, and safety practices in outdoor activities. First is common outdoor injuries, strain and sprain. Strains affect muscles while strain involve ligaments and tendons, both cause pain, swelling, and restricted movement. Fractures. A fracture is a break in a bone. Symptoms include pain, swelling, and deformity. Burns. Burns can range from mild burns to severe third-degree burns. Hyperthermia. Hyperthermia occurs when the body loses heat faster than it produces, leading dangerously low body temperature. Heat stroke. Heat stroke occur due to prolonged exposure to high temperature and inadequate hydration.
The term first aid refers to administration of care to prevent deterioration of the victim, to aid recovery, and to preserve life. Generally, first aid entails some simple but often life-saving that most people can be trained to perform with minimal equipment. First aid is the initial care given to a person who has been injured or suddenly taken ill before professional medical helps arrive. General first aid consists of simple steps such as wrapping wound, giving artificial respiration, or cardiopulmonary resuscitation or CPR, caring for minor burns or sprains. Most people can be trained to perform these with minimal equipment such as bandage and antiseptics.
Common injuries and illnesses in doctors. Wounds, cut, and laceration can be caused anywhere from lock, grinding, cutting cell from a knife, and stabbing. First injury is cut. Cut is butayla yang asamad pero matulis na nag-iksan nito is pagkagawit matutulis na bagay like chilya. Ang kadua naman is scrape. Sukat ang nagre-resulta kung mo skin nakakaskas sa mga magaspang na bagay. Pangatlo naman is sa laceration. Laceration or las is bagalatiyahin cut pero iniyahin dakot tapos madugo. Last naman is puncture. Puncture or butas. Sa nido atin is pagkatusog itraisang or dago.
Good afternoon, ma'am. I'm Luigi Migueles and I'm discussing about what would happen after the injury. The first is severe bleeding or bleeding does not stop despite pressure. If the blood pressure is uncontrollable, you should seek the emergency immediately. The second is you suspect there is internal bleeding or inflammation and severe pain in the area. Example like pag pusil ka, may talaga internal bleeding after ito or example mabagot yung ulo, magkakamadig talaga tiya internal bleeding nga magkaka-threaten ita atong life. The third is there is abdominal or chest wound or what we call artery, is more likely arterial bleed or something na like a gunshot or magkakamay dahiyahin ruptured na part or tissue or something naging buno na magkaka-rupture dito organ. The last is blood spurts out of wound. This means na may high pressure blood na makaka-ubusit atong blood na makaka-treating it atong blood.
Have a good day ahead, Ma'am Sabit. My name is Janine Biasis from Grade 12 Gourmet. So this is my report about severe bleeding and internal injuries. Severe bleeding and internal injuries require immediate medical attention. The signs indicating a serious condition include continuous bleeding despite applying pressure, suspected internal bleeding evidenced by inflammation and severe pain, wounds in the abdomen or chest, and blood spurting from the wound. Internal bleeding may not always be visible but can be life-threatening. Quick response, such as applying pressure to medical assistance, is crucial to prevent further complications.
I'm Roxana Astorga, your next reporter in physical education. So let me first read my part in this report. My topic is all about sprains. Sprains are injuries that involve the stretching of the ligaments. This usually occurs when a joint is overextended from its usual range of motion. Nangyayaring sprain kapag ang mga ligament na mga banda ng tissue na nag-uugnay sa mga buto ay naunat o napunit. Karaniwang nangyayari ito sa mga tuhod, pulso, likod at lieg.
Strain is a twisting or pulling of a muscle or tendon. This is usually happen when a muscle is stretched and suddenly contract, such as when of this running or jumping.
Fracture involves the breaking of the bone. We have open, close, displaced, and non-displaced. Open is the bone breaks through the skin. Close is the bone breaks but if does not go through the skin. And displaced is the bone breaks and both ends are no longer straight. Displaced is the fracture is in one spot and the bone is still straight.
Good day, Ma'am Jessica. I'm Angel Albudaño. My topic is about categories of sprain and strain according to its severity. Now, may I define to you the meaning of sprain and strain. Sprain is a stretching or tearing ligaments, tough bands of fibrous tissue connected together into your joints. The most common location for a sprain is in your ankle. Madalas nga nagkakamay sprain is ang mga sporty like ang mga basketball, volleyball, or ang soccer or futsal. Then strain is a painful injury. It can be caused by an accident, overusing a muscle, or using a muscle in a wrong way. Its strain may dahiya mga causes. First is too much physical activities or effort. And the second one is poor flexibility. Then now let's proceed to the grade 1, grade 2, grade 3, which is the category 1, 2, and 3. Grade 1 sprain is may still allow a patient to walk without a pain or instability. For example, na injury ka, but may possible kalagihap nga makalakat kay diri pa duruhan iya ngot-ngot or an pamamaga han na imo na injury. Then for the grade 2, which is the category 2, ini na part may da ka mafe-feel na ngot-ngot or pamamaga, but may still allow gihap nga makalakat lagihap kay dere pagudduruhan iya pag-ulol. Then for the grade 3, which is the category 3, ini na part is bagat severe na hiya. May part nga dere ka na makalakat, may possible nga dere ka na makalakat kay agan pagngut-ngut or an pag-ulol na hinduro. Bagat kinahanglan na ini igre-rest na han imo animo tiil kundiin na injury. Yes. And grade 1 is minor injury, grade 2 is moderate, then and grade 3 is severe injury, which is the category 1, 2, and 3. Then, amula po ato, thank you.
Today I will talk about what is the RICE method, which is a first aid treatment for minor injuries like sprains and strains. This method helps us to reduce pain and swelling and further injuries. RICE stands for rest, ice, compression, and elevation. Rest helps limit movement that can worsen the injury. Ice applied to the area reduces swelling and helps stop any bleeding. Heat the opposite effect. Compression means applying to the area or wrapping with a cloth or bandage to help stop the bleeding. Elevation. Elevate your limb above your heart level to reduce swelling.
Conclusion Conclusion is a traumatic brain injury that is often caused by a bloom or damp of the head of body cuts, brain of seen the end of face, someone lose of forget that happened before head injury under do not. First is First is treat cuts. Second is apply ice before compress if not ice is available. Third is rest until constant disrepair. Four is watch out for something that need injury action.
Now let's talk all about concussion. Concussion is a traumatic brain injury which is caused bump to your head or body. Cuts and bruises may be seen in your head or face. Ang concussion po ay nangyayari lang pag meron pong nagaganap na force lalo na sa ating utak. Halimbawa na lang kung tayo ay naaksidente at yung unang natamaan ay ang ulo natin, may posibilidad pong mawalan tayo ng alaala, makalimutan natin, magkasugat tayo. At yan na din mag-occur yung brain injury which is yung concussion na tinitira ang ating ulo. Ito ay pinakamalala at pinakaayaw na maranasan ng mga tao dahil ito ang pinaka-traumatic o kagaya ng binanggit ko kanina, traumatic brain injury. Kaya po, mag-ingat po tayo palagi. Keep safe.
Blister are a result of ill-fitting footwear. It is especially seen among hikers and trekkers. Blister can be painful and might cause discomfort.
Good evening, Jessica. I'm Sandris Depas from grade 12 Gourmet. So, let me discuss about burns or scalds. Burns or scalds are injuries on the skin caused by hot liquid or heat. So, here's some advices if this scenario happens to you or us. Number one, if still on fire, stop burning immediately through the stop, drop, and roll method. Then remove the flame material from the person. However, if the clothing sticks to the skin, do not pull it out, but cut or tear around it. The second is take off constrictive clothing immediately, like belts, jewelry, and tight clothing, as burns can swell quickly. So here's the first degree burn or top layer skin affected. So number one, put affected area under running water or immerse in cool, not ice, until pain subsides. If no running water is available, then apply compress. The second is cover with sterile non-adhesive bandage or clean cloth. The third is do not apply butter or ointments which can cause infection. So here's the second, affecting top two layers of skin. So here's number one, immerse in cool water for 10 or 15 minutes. Apply compress if running water is not available. The second is do not apply ice. It can lower body temperature and may cause further damage. 3. Do not prick, blister, or apply butter or ointment can cause infection. So, the last is protect burn with sterile non-stick bandage and secure with gauze or tape. That's all, and good evening, ma'am.
Hi, I'm Sofia Bianca Cabello, and I'm here to talk about the first and second degree burn first aid. What you have to do is put the affected area in running water, or submerge in cold water if running water isn't available. Then cover it with a non-adhesive bandage or clean cloth. Make sure to not apply butter or ointment because it can cause more infection.
Burns penetrates a layer of skin. Skin is charged looking with white, brown, or black patches. Burn blister is larger than 2 inches or odds. Hands, feet, face, or genitals are burned. The person is an infant or senior. What is the burn? Penetrates or layer of skin. Burn penetrates or layer of skin is third-degree burns, also known as full-thickness burns, are severe burns that penetrate or layer of skin, causing damage to tissues and potentially leading to infection, scarring, and even death. Here's an example of burn penetrates of layer of skin. Prolonged export to flames, electrical shock, severe scalding. Fourth-degree burns can damage not only the skin but also underlying tissues such as muscle, bone, and organs.